Hello, my name is Tawa Babawale, student nurse practitioner at Asian University. Now I have here with me, I'm here to conduct a head to toe assessment and also to obtain health information history from your name, please.
Tawa Babawale.
What's your date of birth?
January 10th, 1999.
What's today's date?
April 10th, 2019.
Okay, thank you. So, before we start, would you like to use the bathroom?
No.
Is there any hearing or visual impairment that will prevent us from going further with this interview?
No.
Okay, thank you. So what brought you to the clinic today?
The checkup.
Checkup. Okay. Do you have any past medical history?
No.
Do you have any history of, are you taking any medication regularly?
No.
Are you taking any food supplements?
No.
Any vitamins?
No.
Any over-the-counter medication?
No.
Okay. Do you have any allergy?
No.
Are you allergic to food?
No.
Medication?
No.
Do you have seasonal allergies?
No.
Thank you. Are you up to date on your flu shot?
Yes.
And how your immunization up to date?
Yes.
Is your childhood immunization up to date?
Yes.
Thank you. Have you ever been exposed to any tuberculosis? Have you been? Yeah.
No.
Okay. Do you smoke?
No.
Do you drink alcohol?
No.
Do you take any strict illegal drug?
No.
Thank you. Please avoid taking smoking or drinking, and also avoid being exposed to secondhand smoke. Okay. What's your regular diet pattern? What do you eat for breakfast?
Pancakes.
For lunch?
Chicken sandwich.
And for dinner?
Rice and beans.
Thank you. Remember to eat food rich in healthy food, rich in fruits and vegetables. Avoid fried food. Eat lots of, as I said, fish and baked food and boiled food. Okay. And also, how often do you exercise?
Almost every day.
Or how often every day?
4 times a week.
4 times in a week. Okay, it's good to exercise at least 3 to 4 times a week, and for almost 30 minutes to 1 hour to maintain a good health. And it's also going to prevent you from cardiovascular diseases. Okay, thank you. Also, I would like to ask you, do you have any sleep problem?
No.
Do you have any problem with your bowel movement?
No.
How often do you go to the bathroom in a week?
3 times.
3 times in a week? That's good. I'm going to ask you about your family history. Do you have family history, any family history, medical problem in your family history,
No.
Do you have family history of cancer?
No.
High blood pressure?
No.
Diabetic?
No.
Any history of stroke in your family?
No.
Is there any history of blood disorder like anemia?
No.
Any sickle cell trait in your family?
No.
Okay, thank you. Now I'm going to ask you a specific question about your body system. Do you have any wound in your body? Open wound?
No.
Any lesion?
No.
Any abnormal swelling in your body?
No.
Is your body itching you?
No.
Okay. Do you have headache?
No.
Have you feel loss of consciousness?
No.
Do you feel dizzy?
No.
Are you coughing?
No.
Wheezing?
No.
Do you have difficulty in breathing?
No.
Do you have chest tightness?
No.
Or chest pain?
No.
Do you ever feel that your heart is pounding so fast?
No.
Okay, thank you. Do you have have you been coughing off? Have you ever coughed off any blood?
No.
Do you have runny nose?
No.
Do you have the sense of smell change?
No.
Do you have Do you have difficulty in seeing?
No.
Do you have eye pain?
No.
Blurry vision?
No.
Do you wear eyeglasses?
No.
When was the last time you saw an eye doctor?
Last year.
That's very good. Okay. Next, I'm going to ask you, do you have difficulty seeing in the night?
No.
Okay. Do you have hair problem?
No.
Do you have difficulty in hearing?
No.
Do you have hair pain?
No.
Next, I'm going to ask you, do you have problem swallowing?
No.
Problem chewing?
No.
When was the last time you saw a dentist?
3 months ago.
Oh, that's good. It's good to see a dentist at least every 6 months. Okay? That's good. Next one, I'm going to ask you a problem about your hair. your neck area. Do you have any neck problem? Moving your neck left and right?
No.
Any abnormal lumps showing in your neck?
No.
Okay. Do you have a problem with your, do you have joints pain?
No.
Joint stiffness?
No.
Any numbness and tingling in your hands and lower extremities?
No.
Good. Next, will you classify your overall health? Is it good, poor, or fair?
Good.
Thank you. Next, Mr. Giant, I'm going to start our editor examination. Earlier, before this interview, I've already checked Mr. Giant. Set of vitals. I check his temperature, his respiration, his pulse, his blood pressure, and also I also check his height and weight, and also I check his eye vision using the standard chart, and it was 20/20. His eye acuity was 20/20 with the standard chart. Next, Mr. Jai, I'm gonna start the editor assessment. Okay. Okay. Can you please sit down here? Thank you. Let's flip the camera. Thank you. Okay. I'm gonna start with the skin. No lesion, no skin rash. Skin is warm and dry. Skin is elastic. Color is evenly toned. Skin color is evenly toned. Capillary fill, less than 2 seconds. Here in the lower extremities is evenly distributed. There is no edema of the upper and of the lower extremities, and also of the upper extremities. Capillary field on the toes also 2+. Good. Next, I'm going to check for his pulses. Okay. Radial pulse. Completely pulse. Those are pedales 2+, and also peritibial pulse. All the pulses are +2, and they are strong in all the extremities. Next, I'm going to start with my examination of his I'm going to start with examination, continue with the head examination. Okay. Head is normal cephalic, head traumatic, no open lesion on the head. Head is even distributed on the head of the facial. Let me palpate. Do you feel any pain?
No.
Good. Next, frontal cyanosis, maxillary cyanosis. Do you feel pain?
No.
Okay. Now, open your mouth. Move your jaw left to right. TMJs is non-crepitus and also non-tender. Do you feel any pain?
No.
Good. Okay, your neck area. Okay. No visible pulsation, division of the trachea. No, I want to check for the alignments of the trachea and also to check for guttural alignment. Put the mortar in your mouth. Don't swallow until I tell you to. Okay. Okay, extend your neck backward. Swallow. Okay. Trachea is midline and is no thyroid alignment. Thank you. Next, I'm going to start with the examination of my lymph node. Okay. Occipital lymph node, post-auricular lymph node, pre-auricular lymph node, submental, submandible, tonsil, anterior cervical lymph node, posterior cervical lymph node, supraclavicular lymph node, infraclavicular lymph node. All are non-palpable. Next, I'm going to check for epitracheal node. I couldn't. It's not probable at this time because there's no pathological findings for it to be probable. Next one, I'm gonna start with the cranial nerves assessment. Okay, now close your eyes. Thank you. Tell me what you smell.
Rubbing alcohol.
Good. Cranial nerve 1, which is olfactory lymph node, is intact. Look at me. Tell me when you look at me straight away. Tell me when you see my hand come, okay?
I see it. I see it. I see it. I see it.
Cranial nerve 2, which is optical lymph node, cranial nerve 2, which is optical, is intact. And as I said, I did a standard chart. Patient visual acuity was 20/20 for the standard chart. Next one, I want you to look at me, Mr. Jai. I want to check for extraocular eye movement using the cardinal gaze of vision. Okay? Look at straight ahead. Watch, move, use your eyes to look at me. Don't move your head, okay? 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 Cranial nerve, I was checking for cranial nerve 3, which is the oculomotor, and cranial nerve 4, which is the trochlear, and also cranial nerve 6, which is absent. So cranial nerve 3, 4, 6 are all intact. Next, I'm going to check for cranial nerve 5, which is the trigeminal. Close your eyes. Let me know when you feel the comfortable touch your face, okay?
Felt it. Felt it. Felt it. Felt it.
Cranial nerve 5, trigeminal is intact. Next, I'm going to check for cranial nerve 7, which is the facial, called facial. Okay. Now I want you to smile, frown your face, wiggle your forehead, raise your eyebrow. Cranial nerve 7, facial is intact. Next is cranial nerve 9, which is glossopharyngeal. I'm going to check for the gargle place. Okay, look up. I'm going to put the tongue in the back of your throat, okay? Okay, so cranial nerve 9, glossopharyngeal is intact. Now I want you to open your mouth and say, ha. Okay. Cranial nerve 10, which is vagus nerve, is intact as a ovular raised with phonation. Next, I'm going to do a check for cranial nerve 12, cranial nerve 11, which is called the spinal accessory. Mr. Child, I want you to prevent me from pushing your leg, your face, okay? Resist me pushing your face. I'm also going to resist me pushing your shoulder, okay? Good. Okay. Cranial nerve 11 is inside, which is called the spinal accessory. Now I want you to stick your tongue out, move it left, wiggle it left, stick your tongue all the way out, all the way out, move it left to right. Okay, no atrophy noted. Cranial nerve 12 is intact, which is called the apoglossal. Okay, thank you. Next, Mr. Joy, I'm going to continue my examination by focusing on the eye at this time. Let me do the head because I can conclude my cranial nerves. Okay. Okay, I'm going to close this head. I'm going to do the whisper test, okay? Close this head. I'm going to repeat. No, close this one. Sorry, I'm sorry. Okay. I'm going to repeat some words. Let me know what you, if you can say it.
1, 2, 3.
Good. Close the other one.
4, 5, 6.
Which past test is intact. Next one, I'm going to do the Ryan Weber test. Let me know when you feel the vibration on both here, okay? Or if you feel it more on one end than the other, okay?
It's equal.
Okay. Good. Next.
Come to the stop.
Okay, good. Okay, good. So, gross hearing with the which person is recalled bilaterally, and also Weber test is midline with no lateralization noted, and air conduction is greater than bone conduction. Cranial nerve 8, the acoustic is intact. So, cranial nerve 1 to 12 all intact. Thank you. Next, I'm going to continue with my examination. Eyelashes and eyebrow are midline and symmetrical, and no lid alignments, no ptosis noted, and no lid lack. Next, I'm going to check for the cranial apparatus. Do you feel any pain? Okay. No tenderness, no abnormal discharge, and there is no enlargement also, or redness of the cranial apparatus. Now, I want you to look up. Look up. Okay. Sclera is white. Iris is black. Conjunctiva is moist and also pink. No abnormal discharge noted. And also, I'm going to do cover and uncover test. Look straight at me, okay? No strabismus noted with the cover and uncover text. No strabismus noted with the cover and uncover text. Next, I'm going to do the do examination of the eye. Continue my examination of the eye. Look straight ahead. Ahead, okay. Well, let's go this. Look straight ahead, okay. No hemorrhages, no neurovascular damages of the left in the left eye. With the right eye also. No hemorrhages and no neurovascular damages on the right eye also. On examination of both eyes, when I was examining the photoscope examination, there was positive red light reflex, no AV nicking, no exudates, no contubular wax, and there is no papillary edema. No papillary edema. Next, I'm going to continue my hair examination. Okay, the hair is aligned with the external contours of the eyes, no collaterally. There is no redness, no abnormal discharge, no on the external part of the hair. Also, I'm going to observe it with my otoscope. The light hair first. Now I'm going to observe the back here also. Okay. On examination of both eyes, the external auditory canal, there is no abnormal discharge. There is no redness, and the hair was cerumen is black. It's dark brown. It's dark brown on both ears, and the tympanic membrane is also fairly gray. No perforation, no lesion, and there is no redness noted also. And the Light reflection on the left ear is at 7 o'clock, and on the right ear, the light reflection was on at 5 o'clock. Next, I'll continue with the examination with the nose. Nose is midline. I want you to sniff. Okay, sniff this one. And patent. Let's look. Raise your head up. Okay. And the inferior, the midline and inferior turbinate are moist and pink. There is no redness noted and no rhinorrhea or epistasis. Also, the septum is midline and also not painted. No perforation. Sorry. Septum is midline with no perforation. Next, I'm going to examine the mouth and the lips. Open your mouth. Ah. Okay, thank you. Mouth is lip and buccal mucosa. They are moist and pink. There is no erythema noted, no edematous noted, no cavity of the teeth. All 32 teeth are complete. Back of pharynx is not red, it's moist and pink, and the uvula rise with phonation and no edematous. Tonsil is +1. Next, I'm going to continue my examination by doing the examination of of the lungs area. Okay. Spine is midline. No scoliosis noted. When you feel my palm touch your back, say 99.
99.
Tractor forbitus is equal bilaterally. Around the 10th ribs, I place my palm to check for thoracic expansion. Take a deep breath in and out. And yeah, okay. Thoracic expansion is equal bilaterally. Next, I'm going to percuss the lung area. Put your hand to the shoulder. Good. Okay. Resonance percuss all throughout the lung field. Next, gonna palpate for thoracic, for diaphragmatic excursion. So I want you to take a deep breath in. Wait, let's wait first. Take a deep breath in and hold it. So I'm going to percuss until resonance change to thorax. Okay? Take a deep breath in and hold. Okay. Now take a breath in and out. Breathe normally in and out. Relax. In and out. Okay. Take a deep breath in. Blow out. Blow out and hold. Okay. Thank you. Relax. Breathe in and out. Normally. Okay. Using the centimeter. Measurement in centimeter. Thoracic excursion is 3 centimeters and is normally between 3 and 5. So patient own is within normal range. Next, I'm gonna relax. Now I'm gonna do the CVA tenderness, assess for vertebral angle, and tell me if you feel any pain. Okay? You feel any pain?
No.
Good. Now I'm gonna listen to the lung sound, both posteriorly, laterally, and anteriorly. When you feel the stethoscope touch your skin, just breathe in and out normally, okay? Turn around. Anteriorly. Okay, on auscultation, vesicular breast sound heard both anteriorly, posteriorly, and also laterally. No adventitious sound like crackles, wheezy, or rocky, or pleural friction noted. Thank you. Now I'm going to continue my continue with the assessment of the lung area. I'm going to percuss anteriorly. Okay, resonance percuss all throughout the lung field. Next one, I'm going to start with my assessment of the cardiovascular area. Okay, now there is no. For the beat breathing is chest rise equally and bilaterally. Respiration is at the 16 breaths per minute. That concludes my lung assessment. Now I'm going to start with assessment of the cardiovascular area. I'm going to start in all 5 cardiovascular, which is the aortic area, pulmonic area, the arch point, herb point, tricuspid area, and also mitral area. Okay, first I'm going to listen to the carotid artery, assess the palpate for carotid artery. Carotid artery is 2 plus bilaterally, and listen to for any carotid root first with the bell of my stethoscope. No bruit noted on auscultation of the carotid artery. Okay, now I'll start with the cardiovascular assessment. With palpation first, no thrill or heaves noted. Okay. Now, this is the aortic area, right intercostal space, right sternal border, second intercostal space. Pulmonary area, left sternal border, second intercostal space. Herb point, left sternal border, third intercostal space. Tricuspid area, left sternal border, fourth intercostal space. Mitral area, left sternal border, mid clavicular line, fifth intercostal space. Left sternal border, fifth intercostal space, mid clavicular line. And this is also, I'm checking for the point of maximal impulse, PMI. It's at the left sternal border, mid clavicular line, fifth intercostal space. Apical pulse is 76 beats per minute. Thank you. Now I'm also going to continue the assessment of the cardiovascular area while patient is also lying down. Can you please lie down, please? Thank you. With the diaphragm of my stethoscope, aortic area, right sternal border, second intercostal space. Pulmonic area, left sternal border, second intercostal space. Heart point, third sternal border, left sternal border, third intercostal space. Tricuspid area, left sternal border, fourth intercostal space. Mitral area, fifth intercostal space, left sternal border, mid clavicle line. Next, inhale by sitting and also lying down in all the cardiac area. There is no murmur, no trill, no gallop heard. And the S1 is at the apex, S2 is at the base, no S3 or S4 noted. Next, I'm going to continue my examination by examining for the check for the jugular vein distension. Can you turn right? At this point now, there is no jugular vein distension. Okay, thank you. Next one, I'm going to continue my abdominal examination. There is no striae noted, no pulsation, no lesion noted, and there is no open lesion, no striae. Next, I'm going to also sketch in all the four quadrants of the abdomen with my oscilloscope, with the diaphragm of my stethoscope. Sorry. Relax, okay? Both sounds are present in all four quadrants. With the bell of my stethoscope, I'm going to listen for the aortic area and renal artery, iliac artery, and femoral artery. So I'm not looking for brutes. Secondly, if there's any brute with the bell of my stethoscope. Renal, iliac artery, femoral artery, No brute noted on oscillating with my stethoscope. Next, the umbilical is midline. Okay. Next, I'm going to percuss the abdominal area. Okay. On percussion, dullness hard all over the between in the liver area and also the spleen, over the spleen and the liver, and tympani hard where the air-filled area, just as the stomach and the intestine. Now I'm going to percuss for liver spine. I'm going to percuss for the right mid-clavicular line downward until resonance change to dullness, and I'll also percuss upward until tympani change to dullness. That will determine my liver span. Okay. Now measure. The liver span is at 7 centimeter. Normal range between 6 and 12 centimeter. Special liver span is okay. Now I'm going to palpate the abdomen, lightly palpate the abdomen at this time. Tell me if you feel anything, okay?
No.
Okay. I'm going to do deep palpation at the next.
No.
Okay, thank you. I'm gonna also palpate for liver enlargement. The liver for any alignment. 2 seconds, okay? Okay, within normal, it's not enlarged, and check perfect for the spleen also. Spleen, no liver, no spleen enlargement. Now I'm not try to capture the kidney, okay, by deep palpation the right flank. Just relax, okay? Okay, I was unable to capture the kidney at this time. Okay, thank you. Next, I'm going to now continue with my assessment. I'm going to start with my musculoskeletal examination. Okay, now I want you to move your leg outward, abduction, move it inward, adduction. Relax. I will also do the same for the left leg. Abduction, inward, adduction. Now I'm going to raise the leg in and move the lower leg inward. External rotation, internal rotation. Thank you. Now I want you to prevent me from stretching your leg. Prevent me from pushing the leg inward, okay? And the other way too. 5+ strength noted with the hip. Okay, this did the same. Prevent me from pushing your hip inward. Okay, outward. 5+ strength noted for the hip. Next, I would like you to stand up, sit at the edge of the bed. Thank you. You okay?
Yes.
Okay, thank you. Next, we continue with our musculoskeletal examination. Now I want you to raise your head facing the ceiling, extension, and down facing to your chin, flexion. Raise your head to the midline. Okay. Now let your hair face it down to touch your shoulder, your right ear, your left ear to touch the shoulder. Okay. Use your head. Rotate your head to look over your shoulder. Next, look over your shoulder. Good. Thank you. Next, raise your arm. Let it be on your side. Raise it into the hair. Extension. Flexion in the air. Then backward. Backward. Extension. Good job. Now, put your hand to your side. Go outward. Abduction. Let it be on the plane. Adduction. Thank you. Prevent me from pushing your arm inward. Relax. Prevent me from pushing your hand inward. Good. Good. And you want to prevent me from pushing your hand outward? Strong strength to the shoulder. Next, put your hand to your side. I'm checking for nice elbow arm as a range of motion of the elbow. No, bend it towards you. Flexion. Extension. Good. Open your palm of your hand like this. Supination. Pronation. Good. Now, prevent me from pushing your elbow inward, okay? Good. Outward. Prevent me from putting your hand outward. 5+ strength noted to the elbow. Next one, your wrist. Examination of your wrist, range of motion of the wrist. Now, extension to the air, to the floor, flexion. Okay? Now, look at me. Your wrist also, come, inversion, eversion. Good. Now, prevent me from pushing your wrist downward, okay? Prevent me from pushing it down this way. Prevent me from pushing your wrist. 5+ noted to the wrist. Next one, I want you to hold clasp your hand together. Flexion, extension. Now, put both of your palm of your hand together here. Do you feel any numbness and tingling?
No.
Okay, phalanx is negative. Good job. Thank you. Now we'll continue with the range of motion for the knee. Push your knee outward. This one, outward. External rotation, inward to the midline, internal rotation. Do the same. External rotation, inward, internal rotation. Now straighten your knee. Extension, put it down. Flexion. Prevent me from pushing your knee inward. Prevent me. Good. Just not pushing outward. The same. Same. 5 plus strength noted to the knee. Also prevent from pushing your knee downward. Okay. Pushing down. 5 plus strength noted to the knee. Okay, good. Next one. Your ankle, okay? Raise your feet to the air. That's the flexion, that's the extension, downward. Plantar flexion, that's flexion. Now, excuse me, sorry to disturb you. Can you please push your heel inward? Inward. Inversion. Eversion. Good. Good. Next, prevent me from putting your feet downward. Up. 5 plus noted to the feet. Now, clasp your feet, toes together, and fan it. Good job. Thank you. Now, I'm going to continue my neurovascular assessment. And yeah, next, I'm going to check for I'm going to do deep flex tendon reflex. I'm going to check for the brachial, bicep, deep tendon reflexes, bicep, tricep, patellar, popliteal, and also Achilles reflex, and check for Babinski reflex. Okay? Now, okay. Okay, feel like this. Okay, no, nice. Bicep, tricep, under the angle. Completely. Thank you. Achilles. Thank you. Now I'm going to check for Babinski reflex. I'm going to check it back. Okay. You feel it, right? You're going to feel it. Do what you need to do. Good. Inward, patient plantar flexion was noted. Patient was flexing his toenails. That's negative Babinski reflex, which is normal. Next, I will now continue my neurovascular assessment to check for sharp and dull, using the pin and cutting bone. Okay? Close your eyes, okay? Tell me when you feel sharp or dullness, okay?
Sharp, dull, 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 sharp, 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 dull, dull, sharp, sharp, dull, 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 sharp, dull, dull, sharp, 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 dull, dull, sharp, dull, 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 sharp.
Good. Patient is able to distinct sharp and dullness. That's good. Next, I'm going to do the check. Close your eyes, please, and tell me, open your palm of your hand. I'm going to put something in your palm of your hand. Tell me what it is, okay?
Coin.
Good. Next, I'm going to write something on your palm. Tell me what it is, okay?
4.
Good. Next, I'm going to check for, so the patient has drawn positive gravitational and also serous, some straggleness. Was able to distinct. Next one, I'm going to now check for Okay. Close your eyes. Put your hands to your shoulder. Okay. Do you feel it?
Yes.
Turn your fork to check for vibration. Did you feel it?
Yes.
To the feet?
Yes.
You feel it?
Yes.
You feel it?
Yes.
Good. Next, I want you to stand up now. Come stand towards it. Thank you. Face the camera. I want you to stand straight, squat, and walk squatting. Bend your knee and start walking. Do you feel any pain?
No.
Good. Stand. Now I want you to walk normally forward. I'm checking its gait for any abnormal gait. Turn around. Check your gait also. Keep on walking. Good. No loss of balance noted while it's walking. Now I want to walk heel to toe. Heel to toe. That's good. Stop. Thank you. Now I want you to walk on your heel. I'm checking for gait if there's any loss of balance. Turn around, walk with your heel. Also continue. That's it. Stop. Turn around. Walk with your toe. Keep walking. Keep on walking. Keep on walking. That's good. Next, I want you to stand firm on the ground. Now, put your leg together. Put your hand to your chest. Close your eyes. I'm going to check for lumbar test. Patient is going to remain on this position with his eyes closed for 60 seconds. I'm going to watch out for any swaying, loss of balance. I'm here to protect him in case from falling, in case there's any, he's about to fall. So patient has remained in this position for 60 seconds. No loss of balance and no swaying noted. Lumbar test is negative. Next, Mr. Giant, I want you to, from your waist, move to your left. Waist, left, that one. Okay, to the right. Good. Stop. Extension from the waist. Good. As in flexion. Good. Touch your toenail. Okay. No low doses noted. No scoliosis noted. Thank you. Stand up straight. You okay?
Yes.
Now I want you to rub the heel of your right feet to the shin of your left leg. Do the same. Now I want you to stand on one foot. Now stand on the other foot. Okay. Good. Sit down. This concludes our head to toe assessment. Do you have any question for me, Mr. Jai?
No.
Good. Feel free to come to the clinic at any time.
No.
Okay, if you have any issue, come to the clinic. We'll take care of you. Okay.
Mm.
Nice meeting you, and thank you so much. Thank you.